Hi, I'm Dr. Shu from Line Plastic Surgery here in Los Angeles. Today we're going to talk a little bit about skull reshaping surgery. So when you hear skull reshaping surgery, it sounds kind of extreme or kind of crazy. But actually it's pretty straightforward. Really what we're doing is trying to change the appearance of the shape of the skull, mostly by using implants. And we put those implants right on the bone and under the skin so that basically the appearance of the shape looks improved. The silhouette looks better on profile view and also on the frontal view. Here at Line, we typically use MMA implants. This stands for methyl methacrylate. It's also called PMMA or polymethyl methacrylate. For me, it's a preferred material. I like it because it's very similar to natural bone. We casually refer to it as bone cement. It's the same material that's used for hip implants and elbow implants, and we have probably about 50, 60 plus experience with it in the medical community. The most common requests that we get for skull reshaping usually refer to two locations. Most often, actually, it's the back of the head. This is sort of a skull model, which shows a nice, normal, rounded back of the head. It turns out that some people have a back of the head which is actually quite flat. And that can be congenital, but usually it's because when they're a baby, they're placed on the back of the head and they weren't rotated. Nowadays, we know a little bit more about that, and so babies are usually rotated. Young mothers are told to do this so that the babies have a nice round shape of the head. In fact, some babies have helmets that they're outfitted with at an early age just to help the skull development come into like a nice shape. So for skull reshaping surgery, what we can do for the back of the head is to put an MMA implant right over the posterior portion. This portion which is flat in some people, and kind of bring it out into this nice round shape. And this is sort of the goal. We kind of want to make it look very normal and very natural. For reshaping the back of the head, or we call it the occipital MMA surgery, the occipit refers to the back of the head in medical terminology. For the occipital reshaping, typically the patient is face down on the table, sort of like on almost like a massage table, you can think about it. I usually make an incision sort of side to side, just above the area. So for example, if I'm going to put the implant in this area, which is flat, I would make the incision sort of just above it. And it's no longer the old traditional incision where it goes sort of ear to ear. That's a very old traditional incision. These days, what I do is like sort of a 4 or 5 centimeter incision just in this area. So it's fairly small. The patient face down, through this incision, I lift up all the soft tissue so I can see the flat part of the bone. And once I can see it, then I put the MMA in. And the MMA in goes in sort of soft. It's like a clay or like a putty. And then sort of externally, I'll mold it so that each person's MMA implant is custom. And that's one thing I like about this over silicone, because it's more of a custom implant, whereas silicone implants they're more generic and they're not as well fitted to each person. And once I'm happy with it, once I'm happy with the shape, then I'll rinse it with some water. And that water will set it. And so that way it won't change anymore. Because a lot of people will ask, and do I have to be careful about it? Like if I line it, will it change the shape? But the answer is no. Once you leave the operating room, you're all finished and it won't change anymore. For some people, it's best to think about it. It's almost very similar to getting like a dental filling. The dental filling is placed kind of soft, and then once the dentist sets it, it hardens. And it's a very similar idea with MMA, except it's for the head, it's bigger, and should be happier. For forehead MMA, sort of to round out this area of the skull, there's a couple different reasons why people want to do this. For older patients, it's natural that we lose a little bit of bone and fat and general volume in this area, and it retrudes. It kind of goes back. It's more set back as we get older. So people like to replace that volume and sort of get a more youthful appearance. That's one reason. The second reason also is even in younger patients, they like to have a nice rounder forehead just because I think it looks a little bit nicer. In Asia, where there's a big focus on facial beauty and less on body beauty, they care a lot about facial shapes. And so the forehead MMA is super common there and extremely popular. For the forehead MMA, patient is in the traditional surgical position. They're on their back. Usually I like to put the incision 1.5 or 2 centimeters behind the hairline. It's about a 4 or 5 centimeter incision across. So it's a pretty small incision. Typically what I do is after the incision is made, I'll lift up all the soft tissue off the bone so I can see the sort of the flat area or the part of the forehead that we want to augment and make a little bit nicer. Once I feel I can see the whole thing clearly, then I'll put in the MMA in. The MMA will go in sort of like a putty or like a clay, and then I'll basically custom mold it. And then so that will basically create a nice round shape. Good candidates for surgery. Typically we tell patients that this is not really a great surgery when it comes to volume. If you just want like a bigger head, not great for that. And the reason for that is that the skin itself has a limitation with regard to how much it can stretch. I would love it as a surgeon if the skin was just like a balloon. I could put as much implant material, I could just stretch it out. That would be wonderful. I would have a lot of control over it. But in fact, the skin is a limit. There's a limit how much it can stretch. And so it's not a great surgery just for volume. However, if it comes down to shape, people have a flat area. They're not looking just for a bigger head, but they have a specific area they want to make it rounder. This is an excellent operation. We've done this hundreds of times. Patients are super happy with it. Usually they come in because they've always been self-conscious about one particular area. Put the MMA in, they're super happy, and they're done. The great thing about this surgery is that the expectation is that this should be lifelong. There isn't an expectation for revisions. You need to change it over time. Of course, with any surgery, with any implant, there's always some chance of that. Yeah, but that is not the expectation for this surgery. The expectation for this surgery is that the implant should last lifelong. If needed, it can be reversed. It's not something we expect, but it's possible. We basically would just go in through the previous incision and just take it out in small pieces. That way we don't have to make a larger incision. One question we get asked a lot is whether patients need to shave their head for surgery. And the answer is no. We're very used to operating basically between the hair. In fact, in preparation for the surgery, we'll tie the hair off because patients don't want to shave their hair before surgery, especially for women. They don't want to walk around with the head shaved for a while. So we've gotten very used to that and we're quite good at it. Another question we get asked is whether there's any hair loss around the incision site. Sometimes it's possible. It's not common, but it can be possible sometimes. Typically, for the most patients, right around the incision, they don't have any hair loss. We make the incision between the follicles, heals well, and hardly see it when it heals. In some patients, temporarily, they have a little bit of hair loss right around the area, and in even fewer of those, there's a little bit of permanent hair loss. If there's permanent hair loss, though, it's usually about 2 or 3 millimeters around the incision site, so it's pretty small, but that's pretty rare. I have seen it because I've done hundreds of cases, but overall, I'd say the instance is pretty rare. So immediately after surgery, we'll wrap you in a soft wrap. It looks sort of like a soft space helmet. Basically, it's just a compression wrap, just so you don't have too much swelling, and also so that you don't have any fluid collection. Some people can get a little bit of bleeding underneath the skin. It's not really dangerous, but it's really annoying in terms of your healing. So we like to compress it just to prevent that. The wrap usually will come off at about 3 to 5 days after surgery. We'll just check it to make sure there's no fluid, make sure everything looks good. And then 7 days, the staple will come out. We have a lot of out-of-town patients, even as far as like Finland and Norway. And for out-of-town patients, we usually tell them to stay for like a week just so we can get to the part where you take the staples out and then they can go home. In terms of bruising and swelling, for most patients, it's gone by about 2 weeks or so. They'll see their final results at about 6 weeks, but about 2 weeks, you should feel pretty comfortable going back to work, meeting people, resuming like a normal social life. In terms of going back to full activity, like we have a lot of patients who are pretty fit. I usually tell patients about 1 month for that. So basically 2 weeks, they go back to work. Usually about 1 month, they get back to like full gym exercise type of thing. In terms of light activity, we like patients to do that right away. Even the day after surgery, they can walk around the house. If they're comfortable with the wrap, they can even walk around the block, no problem. Nothing that increases the blood pressure, but typically that's the schedule they adhere to. A lot of men will ask when they can start to wear hats again. Usually in the healing period, like the first 2 weeks, I like people to wear, if they're going to wear a hat, I like it to be kind of loose, nothing too tight. Not because I have any issue with the implant. The implant won't change based on how tight it is, but more just in terms of comfort. You know, they're going to have a wrap on, you're going to have some swelling. Just like a loose hat will be more comfortable. And then typically at about 1 month, you can go back to like a nice hat, something that you're used to in terms of tightness, baseball caps, any of those, no problem.